Hey, it's Dr. Sebastian Gonzalez again from Performance Play Sports Care. Today we're going over a mobility technique for increasing pain-free, pinch-free range of motion in your baseball player with hip impingement. Now this is just one of the mobility techniques we use at the office. There are lots more, and if you follow the link description below in a playlist, hopefully there should be the rest, or there will be the rest in that playlist there, so we're making it all available to you. Now if you don't understand the concept of hip impingement with baseball players, you really need to watch the description that we have below. We have a link available, so check that out. Now this exercise we call decompression with the band. We're trying to distract the hip joint out just enough or to centralize it better with now a movement pattern. The other ones were all static. Now to do this, we usually use a heavy band, which is right here. It's attached to a rig. You'll have to find something very firm to attach it on, since this is a super heavy band. But what typically we find in patients with, or athletes with hip impingement, is they have a positive, what we call Scour's test, which is hip flexion, as well as bringing the knee across. This usually creates a pinching pain in the front part of the hip. Now this is something which we can reduce by increasing the amount of posterior slide, and I'll show you what I mean by this. So if we're in that same position right here, and we have this band attached, which I will attach it in a second, we're mainly, again, in the same test. This one's straight, this one's more in the test situation, but the femoral head being pulled past or being pulled posteriorly or behind will be helpful in regards to normalizing mechanics or movement patterns. Again, this is something that we prep prior to doing loaded exercises or loaded complex lifts. Now, try to get as far away as you can from the rig. Get as much tension as you can on the band. So right now it's pulling back again. And I'm just going to mainly sit into this squat pattern, or I guess in this case it'd be a lunge pattern. This might take a couple minutes to accomplish. Once you've done this, I would increase the amount of drive outwards with the hip. This will more simulate the test. Now notice that the knee is bent on this one, which is only into a deep position of a squat. However, there are situations, and we're playing baseball, where your knee is extended more so and your hip is flexed. Maybe not to the degree that is flexed here, but sprinting, for instance, you have to have some aspect of knee bend. So the second one that we typically do is like this. It's the same thing, except for this time we're not going to dive the knee inward quite as much, but we're going to move the pelvis in relationship to it. And we're just going to go through oscillations of motion. Now, in case you don't know, when the knee is extended, or more so extended, there's other muscles which are shortened and so on. So we're trying to teach them as well about normal movement patterns. Again, this can sometimes take a few minutes, take as long as you desire, but a lot of times when you retest, or if you go into a deep squat, the impingement has decreased. Now, this is just one of the exercises we use for our circuit on mobility for players with impingement. Now, other things that can be included in there are myofascial release techniques, stretching, or distraction techniques. Most of our mobility circuits take about 10 to 15 minutes, and if you're confused about how to put one together, we actually have a PDF for you. Check out the link description below. We have it all laid out there. We have majority of the things that we use, at least on baseline conditions or just prevention. Now, if you learned something from this video, please share with your teammates. If you don't want your teammates to get injured, or you want your hips to work better, to produce more power, to have more longevity in your playing time, and just for the most part, be a better player, share with them. Thumbs up. I promise they will not be disappointed with what they're watching.